Hello, beautiful people. Have you heard of the term muscle atrophy? Did you know that muscle atrophy, the wasting away of muscle tissue, can occur not only from inactivity, but also due to chronic diseases and neurological conditions? Muscle atrophy is the loss or wasting away of muscle tissue. This condition can result from a variety of factors, leading to reduced muscle mass and strength. It is particularly significant because muscles are crucial for maintaining mobility, balance, and overall physical function. Muscle atrophy, when severe and left untreated, can lead to a range of life-threatening consequences. These outcomes not only diminish the quality of life, but can also lead to severe health complications that may be fatal. Here are some critical consequences. 1. Respiratory complications. Muscles play a vital role in the respiratory system, particularly the diaphragm and intercostal muscles, which are essential for breathing. Muscle atrophy can weaken these muscles, leading to respiratory insufficiency. This is particularly dangerous in individuals with chronic illnesses such as COPD or neuromuscular diseases like ALS. A weakened diaphragm can lead to respiratory failure, the inability to breathe adequately, requiring mechanical ventilation, increased risk of infections. Weaker respiratory muscles can impair the ability to cough and clear secretions, leading to infections like pneumonia, which can be life-threatening. 2. Cardiovascular complications. Muscle atrophy can also affect cardiac muscles, particularly in conditions like heart failure. Reduced cardiac muscle function can lead to congestive heart failure, where the heart cannot pump blood effectively. Blood clots. Decreased mobility and muscle activity can increase the risk of deep vein thrombosis, DVT. If a clot dislodges and travels to the lungs, it can cause a pulmonary embolism, which is potentially fatal. 3. Metabolic disturbances. Muscle tissue plays a significant role in metabolic processes, including glucose metabolism and insulin sensitivity. Severe muscle atrophy can lead to insulin resistance and diabetes. Loss of muscle mass can impair glucose uptake, contributing to insulin resistance and increasing the risk of type 2 diabetes. Hypermetabolism. In chronic conditions like cancer, muscle atrophy is often accompanied by a hypermetabolic state, where the body's energy needs are high but muscle wasting occurs. This can lead to cachexia, a severe wasting syndrome associated with high mortality rates. 4. Impaired immune function. Muscles produce myokines, which are cytokines that play a role in immune regulation. Muscle atrophy can lead to a decreased production of these important molecules, resulting in weakened immune response. A compromised immune system increases susceptibility to infections and reduces the body's ability to recover from illnesses, making infections more severe and potentially life-threatening. 5. Impaired mobility and increased falls. Loss of muscle mass and strength can severely impair mobility and balance, leading to increased risk of falls. Weakened muscles and poor coordination can result in falls, which are particularly dangerous for the elderly. Falls can lead to fractures, head injuries, and other serious complications. Loss of independence. Severe muscle atrophy can result in the inability to perform daily activities, requiring full-time care and increasing the risk of complications from immobility, such as pressure ulcers and further muscle wasting. 6. Multi-organ failure. In severe cases of muscle atrophy, particularly in critical illness myopathy, the condition can progress to multi-organ failure. This is often seen in patients with severe infections, sepsis, or prolonged ICU stays. The cascading failure of multiple organ systems can be life-threatening and is often difficult to manage. Muscle atrophy can be classified into two main types. Disuse atrophy. This occurs when muscles are not used sufficiently. It can happen due to sedentary lifestyles, prolonged bed rest, or immobilization from injury or surgery. Neurogenic atrophy. This type results from nerve damage, which can be caused by conditions such as amyotrophic lateral sclerosis, ALS, spinal cord injuries, or other neuromuscular diseases. Who is at risk? Several groups are particularly at risk of muscle atrophy. Elderly individuals. Aging naturally leads to sarcopenia, a form of muscle loss associated with aging. This can be exacerbated by reduced physical activity and comorbid conditions. People with chronic illnesses. Conditions such as cancer, chronic obstructive pulmonary disease, COPD, and heart failure can lead to muscle wasting. Individuals with neuromuscular diseases, diseases like ALS, multiple sclerosis, and muscular dystrophy directly impact muscle mass and function. Those with sedentary lifestyles, prolonged inactivity, whether due to lifestyle choices or immobility from injury, contributes significantly to muscle atrophy. Astronauts. Due to prolonged exposure to microgravity, astronauts experience muscle and bone loss, necessitating countermeasures to maintain muscle mass. Prevention strategies. Preventing muscle atrophy involves a combination of lifestyle changes, physical activity, and, in some cases, medical interventions. Here are the top 5 strategies supported by research. Regular exercise. Engaging in regular physical activity, particularly resistance training, is crucial. Resistance exercises such as weightlifting or bodyweight exercises have been shown to increase muscle mass and strength. A study published in the Journal of Applied Physiology found that resistance training significantly improves muscle hypertrophy and strength in both younger and older adults. Adequate protein intake. Consuming sufficient protein is essential for muscle repair and growth. Dietary protein provides the necessary amino acids for muscle synthesis. Research indicates that a higher protein intake, particularly from high-quality sources like lean meats, dairy, and legumes, supports muscle maintenance and growth. Physical therapy. For individuals recovering from injury or surgery, physical therapy can be instrumental in preventing disuse atrophy. Tailored exercise programs designed by physical therapists help in gradually restoring muscle function and strength. Nutrition and supplementation. Ensuring a balanced diet rich in essential nutrients, including vitamins and minerals, supports overall muscle health. Supplements like branched-chain amino acids, BCAAs, and creatine have been shown to aid in muscle preservation and recovery. Neuromuscular electrical stimulation, NMES. NMES involves using electrical impulses to stimulate muscle contractions, particularly beneficial for those unable to perform voluntary muscle contractions. Studies have demonstrated that NMES can help maintain muscle mass and function in individuals with limited mobility. Conclusion: muscle atrophy is a significant health concern, particularly for specific at-risk populations. Understanding the risk factors and implementing preventive measures can help maintain muscle mass and function, improving quality of life and physical performance. Regular exercise, proper nutrition, and targeted interventions are key to preventing and managing muscle atrophy. We hope you find the video useful and that it provides valuable insights into maintaining your health and well-being. If you enjoyed the content and want to stay updated with more informative videos, please subscribe to our channel. Your support helps us continue to create content that can make a difference in your life. Stay healthy, take care, and we look forward to bringing you more helpful information soon. References: Journal of Applied Physiology, Research on Resistance Training and Muscle Hypertrophy, American Journal of Clinical Nutrition, Study on Protein Intake and Muscle Health, Journal of the International Society of Sports Nutrition, Findings on BCAAs and Creatine Supplementation, Archives of Physical Medicine and Rehabilitation, Research on NMES for Muscle Maintenance.